Well, the vaccines now have been used in hundreds of millions of Americans and multiples of that worldwide. Side effects, sore arms, headaches are well known, last a day, you don't feel great, you get over it. That's not a big deal, and people should never be put off by that kind of transient short-term side effect. I mean, it's just not a big deal. You take a few aspirin, you have a good night's sleep, you're better in the morning. The significant side effects are extremely rare. There are examples of deaths in the Johnson and Johnson and AstraZeneca, which is not used in America, vaccine rollout, in particularly among women of childbearing age due to blood clots, but they're extremely rare. They're measured in a few tens of people after millions and millions of vaccine doses. There have been extremely rare side effects affecting inflammation of the heart muscle in younger men who have been given the mRNA vaccines. But again, there are a few hundred of these against a few 100 million vaccine doses. So they're extremely rare. And, but COVID causes blood clotting problems that kill people. COVID causes inflammation of the heart muscle that kills people. And the risk of dying of these rare side effects is vastly greater from the disease that the vaccines prevent. And everyone needs to factor that in. We all have the public tends to have a misunderstanding of risk. It always assumes, people in the general public always assume that something bad is going to happen to them. In fact, most of the time, it really doesn't. And I think you're more at risk if you're driving to a vaccine trial site, you're more at risk of having a car crash that will cause you serious injuries or death than the vaccine that you'll get when you get there. We all accept the risk of driving around or just even walking the streets. They are acceptable risks. We can't all sit in a basement all our lives. But the risks of COVID, which has now killed nearly 750,000 Americans and multiples of that worldwide, is very, very real, and the vaccines prevent that. Now in America, we're losing 50,000 people a month approximately at the moment. 95% of those are unvaccinated people, and the 5% who are vaccinated are people in their 70s, 80s, and 90s, or with severely immunocompromised conditions. I mean, we heard about Colin Powell's tragic death this week. He had cancer. COVID took him finally to his death, but he was seriously ill to start with. Well, the risk of dying of COVID is something like 20-fold higher if you're not vaccinated than if you are vaccinated. There are breakthrough infections. I have a friend who's going through it in New Jersey at the moment. She got it from her kids. She's had a bad couple of days. She's recovering at home. The probability is she would have been hospitalized if she hadn't been vaccinated. The vaccines have saved her from a serious bout of COVID. She'll be fine. It's a bad week for her, but better that than what she would have had if she'd not been vaccinated. So, the vaccines aren't perfect. Some people are getting infected, but not in a serious way for most people, particularly people under the age of 50. Their exposure to the virus still exists, it's still circulating, they can get infected, but they are very unlikely to enter the hospital and extremely unlikely to die. Well, they're very well-known substances, and they've been used in vaccines for decades. I mean, even the mRNAs, which are relatively new, have been around as experimental vaccines for the best part of 10 years. They're a little strand of nucleic acid similar to DNA, encapsulated in a little ball of fat, and that is an mRNA vaccine. It is not something weird. It does not contain infectious material. The Johnson and Johnson vaccine is a modified version of a common cold virus that contains a chunk of the coronavirus that you raise antibodies against. that kind of technology has been around for 15 years or so, and it's been well studied in many other diseases, including HIV vaccine trials. None of these vaccines contain infectious virus. They do not contain the virus. One of the sillier myths that's going around is that you can get an infection from the vaccine. You can't. It is literally impossible. And an extension of this myth is that you can shed some kind of vaccine rays that will affect somebody else nearby you and screw women's menstrual cycles, and that you can shed virus and infect people you come into contact with. That's just a lie. It's not even a myth. It's a lie, and it's put out by people with anti-vaccine agendas. And the principal problem we face is where people get their information sources. If you watch a show like this, you get accurate information. If your granny passes on her Facebook feed and says that she's heard about this from some dude or other sitting in the basement somewhere else, you're going to get garbage on as a source of information. If you believe that taking cattle deworming paste, ivermectin, is going to cure you, well, again, God help you, because that won't. And you'll finish up dying of COVID if you're relying on ivermectin or hydroxychloroquine or colloidal silver or some kind of music therapy as a way to keep you alive. They don't. So again, if you're in that mindset, there's very little that can be done to help you. But people who can be helped are the people who are just nervous, people who want reassurance, who want better information, who want to be steered towards accurate sources of information and away from the garbage on the internet. And they're the people that we can focus on, because they're the people that we can still help. The flu vaccines are tweaked each year to represent what is around. And what happens is that because the flu season in Australia and New Zealand and the Southern Hemisphere is in our summer, we learn from our colleagues in the south of the planet what's going around, because that's going to spread north in our winter. So adjustments are made and the vaccine is tweaked, and flu vaccines work. They're not great. They actually will improve over the years as a result of what we've learned from COVID, but we tweak it. At the moment, we don't need to tweak the COVID vaccine. The same design that we used from December of 2020 onwards is still the standard design, and it still works. And we're now hearing about the advisability of a third dose or a second dose if you're J&J recipient. Some people call them boosters, some people call them dose 3, and that will give additional immunity. And that's now recommended for most people. I think the age limit is probably going to be 40, maybe 50. We're waiting for some definitive statements later in the week. And if you're in the age group, go out and get it. Go and get your third shot if you're in the right category, which is 6 months after your second dose, particularly if you're in your 60s, 70s, 80s, particularly if you have a pre-existing condition that would put you at greater risk. Makes sense. Go and get the extra protection you're entitled to. If you're listening to more reliable news sources, you're getting accurate information. So that's the origin of politicization. It's a really weird feature of American life right now that life-saving technologies that were initiated in the Trump administration and rolled out under the Biden administration should be accepted on a bipartisan basis by all Americans, and yet half of America rejects them, and that's a major national tragedy. We have to do something about that as well, because the pandemic will not go away until we are able to vaccinate the 75 or so million Americans who are declining to receive a life-saving technology. And there's an element of patriotism in this now. The people who are refusing vaccination are keeping this pandemic going with all of the adverse economic consequences. We can't have a completely normal economic America. We can't have all businesses functioning normally. So, they're damaging the economy. They're damaging people around them. They're keeping the pandemic going. And I think it's an act of extreme selfishness to refuse vaccination when the consequences are not just on yourself, they're on all of the rest of the people who are around you and all of the rest of America. So I think it's un-American and unpatriotic to adopt this "we're not going to take a vaccine" attitude. 6 months ago, most of us in science and public health were opposed to mandates. We thought it's not a great thing to have to do. Now we've all come to accept that you have to do this, that mandates are the only way to now drive people to be vaccinated for the reasons, and the reasons they need to be vaccinated is what I just said. It's unfortunate, but we don't see an alternative because people are refusing advice, and so they need to face up to the consequences, be vaccinated or be unemployed. And that's not a great choice, and it's not something we wanted to see happen, but it's something that now many of us think absolutely has to happen. I'm in favour of vaccine mandates for flying domestically. The Canadians do this. You can't get on a plane and fly from Toronto to Ottawa unless you're vaccinated. I think that should apply for people who want to fly from Washington to California. If you won't be vaccinated, get walking or rent a car and drive yourself, because you're putting people at risk on the planes, and people you encounter when you get to your destination are also being put at risk. You're putting the TSA staff at risk. So I would bring in mandates on domestic travel. There's mandates on international travel, and like I say, the Canadians have done this for over the past month, and it seems to be working up there.